All right. Hello, everyone, and welcome back. I'm Brett Norton from Beyond Clean. And today, has been such a great and incredible day of learning with thought provoking discussions and all kinds of different new ideas to implement and to think about as we move forward this year. I want to thank all of you guys for being engaged with today's presentations and speakers. And as a reminder, in the upper right-hand corner of your screen, you'll find many downloadable documents that have been provided for you by our event sponsors and speakers. Their sponsor, excuse me, that would be Censis. You will also find bonus CE content provided for you by Beyond Clean and Censis, along with instructions for downloading and accessing your CE certificate. Our next speaker is here to keep this day of education rolling. Kelly Swales is a Director of Clinical Services at Censis Technologies. Within her role at Censis, Kelly provides CensiTrack utilization assessments and training, and Kelly earned her master's degree in organization leadership with a focus on employee engagement. She strives to help others understand the why behind what they do in sterile processing. And Kelly also holds 4 certifications with ISHM, now HSPA, as we're all trying to get accustomed to, and she has earned her Golden Crown status. Today, Kelly is going to help us explore the correlation between today's sterile processing staffing crisis and the electronics tracking systems used in SPDs. She will also demonstrate the value of electronic tracking systems have not only on our department's efficiency, but on staff retention and productivity as well. Are you ready to discover the true value of your department's tracking system? Let's find out now. Let's welcome Kelly.
Hey, Brett, we're working through a couple of technical issues.
Okay.
You want to give some announcements? We'll be right back.
We can certainly do that. So I wanted to really touch on one of the things that we got coming up here, which is exciting, and we've been doing it over the last couple of years. That is SPX, and SPX started in 2020. We rounded it out last year in 2021 with a great event and a number of different vendors. And so we are continuing forward with SPX 2022. What's really unique about this entire event is that it's social media based. So we're not going to be going through the virtual process of introducing people to go into a virtual conference center. It's really going to be pushing out that information to all of the audience, and very accessible because it's social media, it's free, and we're going to have a number of different vendors, over 20 vendors that are going to be presenting and providing new materials for all of you out there, new materials, new services, maybe some innovations to current services and products. And so this is going to be a good segue when it comes to the events coming up, also a summary based on, say, AORN. And we've also got HSPA coming up for all of you in sterile processing. So going to be a good kickoff to all of that. But again, it's going to be something really great. You can hop on and register for that. We will provide some of the registration info in the comments, but we will definitely make sure that we're pushing that out to the audience over the next few weeks. So keep an eye on social. We also have a regional event coming up next week, Friday on April 1st. That is an event that is going to be centered in the Connecticut area. So for those of you in Connecticut, feel free to join on in. We will be providing that information as well on social here coming up. But that's going to be some good education in regards to the regional. event or a regional access, but we're going to have some great speakers involved in that as well. So let me check in here and see if we've got Kelly available.
Hey, this is Kelly. I just dialed.
Great. We will go ahead and hop off, and let me know if you need anything, and we'll go ahead and get started.
All right, thank you. I just need to make sure that when I go to the next screen that you're seeing the next screen. Did that work?
Yep. Yeah, we're good to go.
Awesome. Thank you so much.
Thanks, Kelly.
Thanks. All right. So welcome, everyone. Sorry for being a little late here. Little technical difficulties going on. As you know, in today's world with technology, you never know what things you're going to come across. So today we're going to talk about sterile processing and the staffing crisis. And, you know, when you look, it's like everyone's short-staffed. Everyone needs techs. And so with this, you know, what I want to share with everyone is looking at embracing your staff, encouraging them, appreciating them. You'll see an increase in production and quality. But along with that, then let's think even into the future. And what are we going to do? We need to get more people into the field, and then we need to retain those quality staff. So as we go through this, you'll see some creative ideas, some ways that if you have a tracking system, you have immediate tools that can give you that help right away, as well as then looking at the future and what we can do going forward. So as I mentioned, we're going to discuss the current staffing situation and statistics, understand the impact of how our increasing workload, how it's having that effect on staffing. So whether it's we're doing more surgeries nowadays, or the clinics are doing more things, so you're getting all these clinic instruments in, as well as the complexity of those instruments. We'll look at opportunities for efficiency, and then, as I mentioned, look into the future and how we can be prepared. So a demand for sterile processing or SPD techs, it's been on the rise for years, and that's no secret. And with hospitals expanding, new surgery centers and endoscopy centers opening, combined with that complexities of those instruments and the requirements for reprocessing an instrument, we need more staff more than ever. So for years I've heard we need more FTEs. And when I'm working with customers, you know, I show them how to run an annual report that will detail how many containers were processed, how many pill packs were processed, how many scopes were processed over a year. And when you take those years and you combine them, it's not surprising to see that every year it increases. You always kind of see it always trending up. Unfortunately, many times what we see is the FTEs for your department have either stayed the same or they decreased, because with budget cuts come when you have a position open, now you have to prove that you need that position. So if you're not using your reports to show that you need these people, you know, I say work with your client manager, work with someone out there to help you understand those reports and run them so that way you have that information and that can help you. On to stats. So a few weeks ago, I logged into Indeed, typed in sterile processing, just as my key search, over 8,000 jobs. Took it one step further, added the word tech. There again, one step further, added the word travel. And with that, it's not surprising to see how many positions are out there. What was surprising, I mean, and I knew this, but it was not was there in front of me, is that pay. So the hourly pay for permanent staff in the United States, from the lowest paying state of $14 an hour on average to the highest paying state of $25 an hour on average, that's a pretty big gap. And I understand demographics play a big part in that. It's a lot cheaper to live in southern United States than it is in, say, San Francisco. But then you look at the hourly pay for travelers, and it averages out to what they call the hourly pay. But part of that is your housing. There's things in there that you're not paying taxes on, so it's even more money and it's better. So when you look at that, it's not surprising that people are leaving to go become travelers. Recently, I had an assessment scheduled at a hospital. So I go into hospitals and I perform utilization assessments to see how well they're using our tracking system. And when I arrived, I learned that all 10 staff had either called in sick or didn't show. So the manager was only one in the department. And my heart just went out to her because, I mean, there was nothing I could do to help. I mean, I wish I could have just went to the department and helped. And, I mean, it was just devastating for her. And then recently I was at another facility. And when I was at that other facility, they had 40 FTEs, but 22 openings. So it's a common thing that I'm seeing across the board, even myself. So due to growth in my company, I have openings on my clinical team for educators and trainers. I know many facilities are losing their staff to traveling, and then many are having to hire travelers. So it's kind of this little cycle that we're in that we need to get away from. So as we talk about staffing, the customers have shared with me that overtime is not allowed. And some tell me the hospital approves all overtime because it's cheaper than adding an FTE, and overtime is what's keeping them afloat. When I review their account with them and see the bottlenecks in decontam and assembly, it's typically a staffing issue. So if they're keeping up with the demand, I'm told they're concerned that staff are skipping steps or rushing. And then this leads to errors and perhaps a non-quality item. So add to this the question that may occur of, if you're keeping up with the demand, why do you need more staff? Or if you have all these openings, but you're keeping up with the demand, then you're probably not going to get too much help with trying to get them filled. So it's a double-edged sword with no easy resolution. So while, yes, overtime is great when it's here and there, but when it's every day, staff they just get worn out. They're tired, they're stressed, and along with that, then that tension can take its toll on their body, both mentally and physically. So then you run the risk of sick calls. I've had staff tell me they really need to get home, but feel bad if they leave at their scheduled time because it's not fair to the coworkers. So staff are stressed, overworked, and some are giving up and quitting. From early retirement, career change, and going to a surgery center with no holidays or weekends, I think we're seeing it all across the board. So why can't we find staff for sterile processing? I feel it always comes back to wages. Why work in SPD when I can make more money at Costco? People's lives are in our hands, and yet McDonald's pays more than here. We can't find staff who have experience or have been through tech school. And so with that, it's kind of what do we do? So some facilities hire staff with on-the-job training, and it can take a year for that staff person to be fully trained. So while they're considered one of your FTEs, their skill level and ability is not the same as their counterparts. So while staffing has been an issue for years, we add to that the pandemic. So in my role, I travel to almost 100 facilities a year, and I've had literally only one, tell me that they were fully staffed. I've been to facilities that are 50% of their staff, or they used to be 24/7. And now they're just day evening with night call. They're that short staffed that they just can't, they're doing whatever they can to stay afloat. The only saving grace for some is that due to the pandemic, the cancellation of elective surgeries, or patients delaying surgery due to the pandemic, and a reduction in clinic visits. So that's kind of been a help for some. However, some tell me they're busier than ever because they're a surgery center and are doing all the total joint cases that would normally be done in the hospital. So if anyone belongs to an SPD group on Facebook, you know there are multiple posts today about staffing and traveling and how it's on the rise. Some facilities are losing their most skilled workers to traveling because they get to travel, and some are making 2 to 4 times their wages from when they weren't traveling. And if your lifestyle allows for travel, you can't blame them for taking that opportunity. With wages and stipends, some travel placement companies, they're paying $3,000 a week. I'm guessing that facility is paying over $6,000 a week to that travel company. So this may be a quick temporary fix for the facility, but if you're paying thousands more per week than what you'd pay for permanent staff, that's not being financially responsible. So fix the problem because the quick temporary Band-Aid won't fix the underlying issue. So what can we do? So let's talk about the sterile processing profession. You know, we talk about wages being an issue, but what about everything else that comes with working in sterile processing? We know sterile processing is an underappreciated and unrecognized department until there's a problem. This is typical for the behind-the-scenes departments in a facility. However, the attention to detail, skill, and ability to process an instrument takes a thorough and conscientious person who will fully inspect, follow all the steps, and simply do what's right, which, as we know, this is not just anybody. Add to this the thousands of different instruments that you need to learn, the complexity of instruments. We all know this retractor comes apart 7 times, but that new person doesn't. Or we know that we need to remove different parts of an instrument because it's considered a sharp, it can't go through. So if the OR sends it to you, make sure you remove it. And then you got the complexity of sterilization equipment and documenting pertinent information. And then you have a trade. So when you look at this, sterile processing is a true trade. And it's a position that requires it's a position that maybe should perhaps require post-secondary education, and most importantly then, be identified as a profession. So in 2020, the U.S. average hourly wage, as I mentioned, that we talked earlier about, was $19.75 an hour. And so, of course, we know those demographics, but let's think about this for a minute. Back in the day, way before my healthcare career, a surgical technologist learned on the job via on-the-job training. So that OJT allowed them to be hired off the street, and then they were trained on the job. Then it changed and required post-secondary education. Some facilities even require an associate's degree, not just a surg tech diploma. And then now there's many that are requiring certification. So you have to ask yourself and wonder, is this what is needed for sterile processing? Facilities would grandfather in current staff and then take the plunge and require a certificate, diploma, or associate's degree for sterile processing. That would help us be recognized as a profession. And then along with that, you would see an increase, hopefully, in pay, as well as staff staying with the profession. So there's over 6,000 trade and technical schools in the U.S. So what if they all offered sterile processing? Some of these programs are 1 semester long, and you have an internship. So not only are you learning in the SPD department, but it's your foot in the door to healthcare. It's a quick way to have post-secondary education and a job that pays above minimum wage with benefits. When I look at this too, I think, let's reach out to our high schools. Is this something that they teach? Back in the day, we called it home ec, but what's called nowadays, or we had, metal shop or wood shop. Well, does this need to become something that they teach in the schools so that when these kids graduate, they can go right into this profession? Along with that is reaching out to your technical colleges and maybe your hospital that partners with them. So for a technical college to start teaching sterile processing, they're going to have clinic time. They're going to have to be on site somewhere because no technical college can probably afford to buy all the instruments. But if you partner with them and they can hold class at your facility on a weekend, in an evening, certain day of the week that's scheduled, then you are helping them and they're helping you. So we know there's a problem. We know there's not an easy flip the switch fix. But given the demand for SPD techs and statistics stating it's a growing profession, I feel we need to get on board before it's really too late. So what can we do? So if you don't already have a tracking system, I always say the number one thing is get one. I started out working in healthcare as a surg tech where we processed our own instruments, didn't have a tracking system, took forever to go get that count sheet out of the drawer, check everything off, write on it, all your little notes, building the sterilizer lobe, having to write everything down. And so when you think of all the time you spend writing on paper, that takes up a lot of time. And the time it takes you to write, let's say, Censis, craniomaxillofacial screws and plates, I could probably have a whole load scanned because I'd have to look up and remind myself, how do I spell craniomaxillofacial? So will not only will that tracking system provide efficiency, it will assist with documentation compliance. If you set up your account, or you can set it up so that if something is missing some information, so like if I'm going to build a sterilizer load and the load before that is missing some information, I can set up my account so that it won't let me build a new one until that previous load is fully documented. Along with that, if I'm using it for container assembly and I have a missing instrument, I can just run that daily report and see what's missing. Then I can work with service leaders to say, hey, do I need to replace this? Do we know where it's at? Can I just take it off the count sheet? So there's a lot that we can do. The other thing is work with your C-suite leadership and help them understand the importance of sterile processing and how you every day prevent harm to staff and patients, prepare the instruments so the OR, which is typically the highest revenue generator, can perform surgeries, and provide them with stats. With those stats, you've got to make sure you attach that link to that internet search or where you got the information from so they can research that too. And then explain that you're paying travelers a lot more than what permanent staff are making. And as I say, just bite the bullet. Raise the wages so staff apply to work there and stay, because in the end, it's cheaper than paying for travelers. If you have a tracking system, there are some quick fixes. So I look at it as it's all about the T. Time technician in your trees. So go paperless, save those trees. And look at the time. As I mentioned, building that sterilizer load. If I go to build a sterilizer load and I have to write down every single tray name, and not just the tray name, but what number of that tray is it? Is it 1, is it 2, or 3? All those peel packs, it's not okay to just write peel pack times 50. You need to write down the peel pack names. By the time I write everything down, that can be very lengthy. And here I could have just scanned a load and been done. I was at a facility recently, and it was new manager. And so when I arrived that morning, he had told me that he worked the night shift. He just wanted to come in and see what's going on at night. And he was, had used our product since Track, had used it for years, now came to a new facility. And he said, I can't believe they're still doing paper along with electronic documentation. And I said, oh, I know. I said, you're doing double work. It's taking up so much time. And he said, no, you don't understand. He said, I ran all the Bowie Dix and I ran all the wash tests. I did everything in Censis, everything's beautiful, everything's great. I then went and had to sit down and do all the documentation on paper too. And he said it took him an hour. And so he said, if they're doing paper, and I look at how many loads we do a day, that's literally 1 FTE. So if we get rid of paper, then look at the time we're going to save. And so I showed him, yes, do quality audits, make sure everything's beautiful, everything's in there. There's no reason to have that paper. Another with your solutions is accountability. So when you look at that accountability, you want to make sure that you're holding your staff accountable. It's really hard to sometimes hold staff accountable when you are when you can't afford to lose them. So you have this, this person that they call in sick all the time. However, you can't afford to lose them, and you need them when they are there. So you're kind of stuck in a little situation. So nothing worse than being held hostage to a position. And I believe we've all been there, whether it was one of your staff members or it was a coworker that was they were kind of held hostage to that situation where they couldn't afford to get rid of them. And so you're so short-staffed, you can't afford to lose someone while their productivity is not where it should be, or they have attendance issues. It then becomes a challenge because you need them and would rather have them when they do come to work or not have them at all. So the key thing here is you must uphold policies or SOPs and treat everyone fairly. Keep in mind, if you make an exception for one and not another, you may have more issues on your hands. I had a gentleman, phenomenal person, but we kept getting dirty instruments coming from decontam. And he needed cataract surgery. And so it was kind of that heart-to-heart conversation I had with him that said, we've done education. We need to talk this through. How can I help you? And I said, I really recommend you go to your doctor because maybe you need different glasses. He had that cataract surgery and got different glasses, and phenomenal. Complete 100%, perfection with all his cleaning. So there's those little one-on-one conversations you have to have sometimes to help people, but just make sure you're treating everyone fairly. When upholding policies and SOPs, as I said, work with staff to educate, coach, assist. So in other words, be a leader and not a boss. I believe we're in this profession because we want to produce quality items that help to save or improve lives. So in other words, we want to do what's right. As I mentioned, you could go to Costco or McDonald's, but I feel that that's not giving me the quality I need in my life. So then why not just work in sterile processing and love what I do? So if you've done all you can, you'll have to ask yourself, is this staff member move them up or move them out? And if they're down here and make everyone else is up here, so if they're down at the bottom and everyone else is up at the top, and you've exhausted all resources, you must make the decision to do what's best for your team, your patients, your customers, and your facilities. So let's talk about retaining your quality staff. So when you look at your great staff, the ones that are your hard workers, very few or no quality issues, what can we do? So we always hear the saying, the grass isn't always greener on the other side. And some will say it's true, but it's different grass. I travel to many hospitals, surgery centers, clinics, and guess what? It's all the same, just a different address. So if someone leaves your facility to go down the block, you must ask yourself, why? So now I know hospitals sometimes can't compete with surgery centers, and I get that because they're just open during the day, not on the weekends, no holidays. So that's something that's kind of an outlier, that how do we can't really compete with that. But you have to ask yourself, if staff are leaving for other reasons, you need to know the why and work on a solution. But please don't take this on alone. So contact your HR department. Ask about market wages for your profession. Are there classes, mentors, committees, and resources to help you or your staff? So no one has all the answers, and you should never hesitate to ask for help. Along with that, then, you can look to your HR department and then kind of do that analysis of the wages and see where we're at. Years ago, I applied for a position during an interview. Applied for a position, and during the interview, I was asked, if I hire you and you then leave your current position, what will your staff miss most about you? And I said, my baking. The lady interviewing me was shocked and started laughing. I got the position. So then I later learned from her, she said, everyone else says, oh, my teamwork, my sense of humor, my willingness to help others. She said, so when I had a different answer, she was shocked. And I explained, I love to bake, but I don't eat it. So one bite and I'm done. So I bring treats to my staff all the time. It's one way of showing my appreciation, and it's not a pizza party. So think of the little things you can do for your staff or your coworkers even. And along with that is do those things. It could just simply, maybe it's a little thank you card. Someone stayed late and helped you, or someone helped you learn this new set. Send them a little thank you or a little Post-it note saying thank you. Put it on their locker. Let your staff know they're doing a good job. Send them a note to thank them for staying late, finding that container for the OR, or simply just being an awesome person. Maybe they said something and made you laugh and turned your whole day around. Let them know. And then don't forget, do not micromanage. Understand where they're coming from and be mindful of what you're saying. It's one thing to say I have an open door policy and staff can discuss anything with me, but maybe they don't want to. So provide them also an alternative method. They can write a note. They can talk with someone else. Years ago, I learned this saying, and I've used it so many times throughout my life, especially when my kids were younger. However, they would also be very quick to turn around and use it on me. But that saying is your delivery defeated the purpose of the message. And as you know, they say body language says more than your words. So let's say you have another quality issue. You go to huddle and you say, we had another tray with no chemical integrator. What does it take to get everyone to always put integrators in your sets? So staff right there kind of comes across, they're going to be defensive. So think about if I would go in and I'd say, hey, I received a quality event from the OR, and they had a container with no chemical integrator, or container with no chemical integrator. I know we process a lot of sets, and missing an integrator is less than 0.5% overall, but this time it was the major ear tray, and we didn't have another one available, so they had to delay the case while the set was sterilized. Does anyone have ideas, suggestions to help us, remember to add that integrator? I want us to work together and provide a solution so we can all succeed. Now think about those two. Which one's going to get a better response? Bring people in, use their ideas. As I mentioned earlier, we don't have all the answers. And then if you're involving them and someone says, oh, well, you know what I do? When I get a tray, the minute I set it on my workstation, I look and see how many integrators am I going to need. I grab them and I put them right on my table. So then if all of a sudden I close everything up and they're sitting there, I know I forgot them. And this person said, that's the first thing I do. When I set it down, I scan it, I see exactly what the set is, I see how many trays are in there, how many levels, and I grab my integrators and I set them there before I even touch an instrument. And I love that idea, and I shared that back in the day when I was working in the hospital, and that helped with a lot of people. So we're all human, we all have feelings, we all want to do good, and everyone needs to be treated with respect. So when you're communicating, you're talking, you're educating, be empathetic and strive to understand. I'd love to say, help me understand, because we don't know where they're coming from. But celebrate the wins, no matter how small, show your appreciation, but then again, only if it's sincere. So I encourage everyone to go to your team, your staff members, your coworkers, create an anonymous survey monkey and ask them, what makes you stay working here? And if you left, what would be your reasons? You don't know what you don't know. And you may find some simple wins and common answers. You'll then have something to work with, and you can set goals to be the department no one wants to leave. You can't put a price on happiness. So even if the hospital down the street is offering $1 or $2 more an hour, if you're happy where you're at, think about after taxes. That's only $30 to $50 for a 2-week pay period. It's probably not worth it. If you're happy where you're at, and now you're going and you're leaving the people you like, your coworkers, you don't know what that grass is like on the other side, probably not going to leave because it's not worth it for that $30 to $50. So staying ahead of the future. So your low performers will move up or out, and your high performers or quality staff will stay. Add to that, when you reach out to your high schools, your workforce centers, your technical college to offer sterile processing courses, you'll stay ahead of the future because you'll have staff to recruit and quality staff that stay because you're offering market wages and a great work environment. So quality feedback. Don't forget to use your quality feedback tools. Document the pass, the fail, the good and the bad. Unfortunately, many times we punish people for making mistakes. When if you took the time to get to the root cause, you may learn they need education. So please help staff understand how the quality of their work affects compliance, patient and staff safety, and the overall customer service. Then educate, 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 so that everyone understands and knows how to correctly perform the assigned tasks. They're doing things that are quality. You're providing that positive quality feedback. With that comes happiness and joy and being appreciated. And then you'll have the staff that stay with you. So at this time, I'll take the questions and answers. It looks like we have quite a few here. And let me just scroll to the first ones here. Yep. So we're trying to get help and no one applies. We need to let people know what we do and the benefits. So, as you know, I mentioned working with your technical colleges. So years ago, when I was in scrub tech school, I worked at a children's hospital across the street. So when I would leave work and go to class in the evening, there were many times they would loan an instrument set to the school, so I'd bring it with me. And we'd use it, learn the instruments, go through everything. We'd wrap it. We'd do everything because back then we did our own instruments. And then I'd take it home with me, bring it back the next day, drop it off at Deacon Camp. And there was a partnership that was awesome, and everyone benefited from it because not only are all these scrub techs learning their instruments, but the school's not having to pay for them. And then the Children's Hospital kind of, promoted and mentioned that they're partnering with them and helping them to learn. Along with that, when you say you can't get anyone to apply, back when I was working in the hospital, I had kind of what I called my one position that I always left for a scrub tech. So you would always get scrub techs that apply. And I knew, yep, I'll hire them. They'll work for me 6 months, and then they'll apply to go to the OR. But I was okay with that because now when they go to the OR, they're an ambassador for sterile processing. They're going to be someone that can help us and make people up there understand what's going on down here. As well as we always joked, and their trays better be perfect when they come back. You also then have someone, if you need help, hey, can you stay late and come work in sterile processing? They could pick up some hours, and you had some more resources for when you're short staffed. So think about your scrub techs too that are looking for jobs. Yeah, another one here. Sorry, the next one talking about the pay is terrible for the work that is required. So your full-time staff make horrible money, and travelers come in and triple what they make. And that kind of, back to what I said, talk with your C-suite staff. Help them understand where you're coming from and look at the financials behind it. And even if you don't know what they're paying for a traveler, still work with them. They have those numbers. They can get them. And it may just be okay, we need to bite the bullet, pay these increases, get staff to stay. And so it may take a year of increasing the wages, but you'll see that it'll be so much more beneficial. So hospitals should hire credentialed CRCST subject matter experts to lead education training programs, such as the same programs being offered at learning situations, like one-stop shopping. And so, yes, and even take that one step further. How about going into your high schools and teaching this? There's many times years ago where I would go they would have a career day, and I would go to one of the schools, or they'd bring them to the hospital, and I'd stop in and talk about sterile processing. And so these kids got all excited thinking of all these instruments that they were going to see, and knowing that, hey, rather than, I'm in Minneapolis, and so with that, I can graduate high school and go make $10 an hour back then, or I can do a semester at our community technical college, get my sterile processing certificate, and I was starting them out at $17 an hour. And that was probably, what, 8 to 10 years ago? So what a great opportunity for these high school kids. All right, and so my last facility, we did in-house education of what sterile processing was and offered trying to staff in other departments like transport, dietary, shipping, and others. Yep, so, put that out there. Sterile processing week, I set up a open house and had certain times throughout the week where any of the employees in the hospital could stop down and see what we do. That was more so they would appreciate what we do. But think about that, someone coming through and thinking, oh my gosh, my son would love this, or I have a friend looking for a job, or just even seeing your department. They may know someone that works in sterile processing, and they're looking to relocate, and here you go. So you never know. It's all about networking and opening those doors. Do you recommend using instrument tracking data for individual annual review for technicians? Absolutely. Absolutely. We talked about quality feedback. So utilizing that quality feedback. Yes, we live in a world where we focus more on the negative than the positive. If I open up my can of green beans and there's green beans in there, I'm not writing to Green Giant and saying, hey, thank you for putting green beans in my can of green beans. No, it's when I open it up and there's corn in there that I'm writing to Green Giant and saying, hello, what are you guys doing? That says green beans and there's corn. So, yes, it's always nice to pull through those positives, as well as then there's areas of improvement. When you're using quality feedback, make sure you take good notes and then track everything in there. So, for example, if I go to someone and I say, this is the 5th tray this month that you forgot chemical integrators. And I know we've talked this through. We've shared with you some different ways to help out. And they say, okay, I'm going to try, so-and-so's way that they do it and see if that works for me. Put that in your notes. Make sure you're documenting everything. Because then when that staff person has a win-win, what a great thing to talk about in their annual review. Just say, look at this. We struggled, but then you tried another idea and it worked. So celebrate those wins and appreciation. Can you speak to communicating and thinking through the brain drain you're experiencing in sterile processing with all the resignations and retirements of experienced staff in recent years? I talk to a lot of techs, a lot of staff. When I'm on site doing assessments, I talk to a lot of people, and I'm hearing, oh, I can't wait, I can retire in 6 months. Or, I've been with the government so many years, I could retire now, but I just don't know what I'll do with myself, but I can't keep doing this. And, everyone's going through it. As I mentioned, kind of doing those, celebrate the wins, the appreciations. I know the big joke on Facebook is always, oh, another pizza party. But what else could you do for your staff? I always use Thanksgiving as a time to let my staff know I'm so grateful for them and thank them. Whether it was a card I gave them, a treat bag, I would even leave one on my desk for housekeeping. So, thanking them for emptying my garbage. And sure, they're just doing what their job is, but I really appreciated it, because if they didn't, or they didn't do a good job, then I would have to be doing it, and that would take time away. So it's do everything we can, but yet be sincere. If it's not from the heart, don't do it. And make sure that you're letting your staff know that they're appreciated. Are there onboarding tools that can be utilized with a tracking system to maintain some continuity with staffing? Yes. So I can speak to Censis with that. One of my favorite onboarding tool, and it's just, I think it's a great thing, is using our competency module and then linking that to containers. So for example, if I have someone new that's coming and they're starting, whether they're new to sterile processing or a new grad, I don't want them assembling what I call a true life or death, stat C-section tray, an open heart tray. So I want to start them on some of the smaller trays, get them more familiar, basic instruments. I can set up that competency to where as they're only allowed to do, let's say, complexity level 1 trays. And then when they have perfected that, then complexity level 2 trays. The nice thing about that is if I go and I am assigned I can only do complexity level 1, and I scan a 2, a 3, or a 4, I'm going to get a pop-up saying, stop, you can't do this. So it's not going to allow them to. It's not going to allow them to just assemble it, slap the label on, put it on on the sterilizer card to be sterilized. It's not going to allow them. And then along with that, you can run a report to identify, okay, how many of these complexity ones have they assembled? And compare that to your quality feedback reports, and have there been any quality events? You can then utilize that to say, yes, this is beautiful, and we can move on to our complexity level 2. And even when you think of like new staff, or someone says, oh, we don't hire new staff. We only hire people with experience. So I worked 6 years, worked in the OR, and went to a new hospital. Well, the hospital I worked at for my first 6 years in healthcare, they didn't do hearts. They didn't do neuro. So to this day, I don't know my heart and neuro instruments. Along with that is dental. I've never worked at a facility that did a lot of dental. So dental is another one that I don't know, or Da Vinci. So if someone could work at a facility for 20 years and then they leave and come to you, Well, if they didn't have Da Vinci at their facility, they're not going to know how to process them at your facility. So you can't just look at it and go, oh, okay, well, they have 5 years, 10 years, 20 years experience. They know everything. No, they don't. So utilizing that onboarding tool with that competencies is a phenomenal and great way to have success. All right. Do you think it's important that staffing agencies and managers set clear expectations that agency travelers not actively recruit permanent staff during their contract period? They're not adding to the staffing issues. Yes. Yes. It is very common with the business-to-business agreement that you can't recruit staff. Now, with that, I'll go on site. People will say, oh, I want to work for you. You know, I want to do what you do. I want to go travel. And I can say to them, we'll go to our website and you'll see the job postings there and then see what you're interested in. I can't go on site and say, oh, you're great. You should come work for me. I want you to come work for me. And that should be the same thing with your contracting company. And I would make sure that that's clearly put in that contract so that we don't have that situation. Now, granted, as you know, people may work around it, or they may say, oh, don't tell anyone, but here's what you do. Or they're just asking about the lifestyle, the traveling, and then they can probably learn from there. But all right. So do you have any experience on the impact of unofficial cultural leaders on retaining staff? I had numerous team members through the years that just made coming to work a joy, and they never held an official title. So I see that a lot when you talk about unofficial title. When I'm on site, I always get everyone's name that I'm doing the assessment with, and I ask what their title is. And many times I hear that, well, do you want my unofficial title or do you want mine? And I would say, oh, I need the official title. And there's many times where it's like, oh, I'm a tech. And then I have to ask, well, what's your unofficial title? And it's like everything. So it's, I say if you're in that position, talk to your leadership. Look at that. If there's actually a lead tech position or something along that line, and you are performing that, but you're not, you don't have that official title, get that job description. Share that with your leadership and say, in reviewing the lead tech position, I'm doing all this. Can we discuss some opportunities for me to move to a lead tech position officially? Worst thing is told no. But if you never have that conversation, you'll never know. Yes, management changing as well as staff with new ideas that always change. I go to a lot of hospitals where I'm annually, and from year to year to year, management change. And yes, it's turnover. It's people leaving to do something else, or people retiring. And then are there some recommendations for department managers on things they can do to encourage C-suite leaders to dedicate more budget to pay on-site staff? I have a great idea, but I know probably will never go anywhere. So Minnesota has Minnesota Healthcare Association, I think it's MHA, and it's all the hospitals belong to this. It's all your C-suite staff that are there. And I would love, love, love to see something where someone from sterile processing goes in and presents. And it explains to them exactly what sterile processing is, how it prevents surgery, or, surgery issues, infections, keep staff safe. And then put some stats in there. Let them know how, here's what we're doing. So one, you can stay afloat. Two, you can do your surgeries. And then three, how we're preventing all these added expenses that could occur if there was an infection, if there was an issue. But along with that, another idea is Joint Commission, DNV. I think they should require all your senior leadership, C-suite leadership, everyone to spend certain amount of hours in the departments that are below them. So, for example, if you are in sterile processing and you report to the OR, and then the OR reports to nursing leadership. Nursing leadership should have to spend so much time in the department per year. And it could be 8 hours. So one work day, and have it be to where it's, 4 hours and 4 hours. Something along that line so they can truly see what goes on. Have them gown and glove. Have them go into sterile process or decontam. Have them get right in there and see what's going on. And then have them go to the clean side. Have them see what it takes to assemble a tray and sterilize it and then put it away and then pick it for a case and then get it to the OR. And then how it comes back, bloody and icky, hopefully pre-cleaned, but even if it's pre-cleaned, it's not always completely clean. So I think that would be a great thing. I always think of housekeeping. If housekeeping doesn't mop a floor, doesn't vacuum a rug, everyone sees it and something's done. If a bathroom's dirty, everyone sees it and a phone call is made. Sterile processing is kind of that forgotten because we're seeing with the cafeteria. If the food isn't any good, portions are small compared to what you're paying, customers are going to complain and you're going to hear about it. Sterile processing, we don't have that advantage of being out there and being exposed for all to see to get that attention to say, hey, we need help. We need to do something. All right. So any more questions? Anything more to discuss here? Anyone have creative ideas that can help others?
This is one of those topics, Kelly, I think that we could talk about for hours, and it's a hot topic for sure in the industry today. I think it's been exacerbated by COVID, of course, the staffing shortages out there, and then travelers, not to put any negative light on travelers, but when you're paid more money to go from facility to facility around the country on contracts, that's going to be much more appealing, and it's going to be hard to retain staff. So I think staff retention, when it comes to the continuity aspect of process flows, workflows, and just maintaining that, that team aspect, I think you touched on some of the things that you can do with your staff, and, there's empathy, and obviously there's the saying, there's no price. You can't put any price on being nice. Are there any other recommendations that you could put out there in return? I guess in regards to efficiencies, right? You can shed some light on some of the efficiencies in the department that are much better handled with a full-time staff that's with you, as opposed to a broken up staff. So maybe you could shed some light on that.
Yeah. So think of the life cycle of a container in AMI guidelines. So you should be documenting that set was cleaned. If you don't have a tracking system, are you really in decontam writing down everything that is coming through? I've yet to see a hospital that does.
I haven't held a pen or pencil in decontam.
Yeah. Along with that, you've got dirty paper then that you have to store. So it's not happening. Utilizing that tracking system, quick scan, just a second scan there, you've documented that it's in there, and who cleaned it. You talk about quality staff. That set now comes over to the clean side. And I take it out of the washer, and I always think of it as choose your battles. When you take something out of the washer, if there's something on it, choose your battles. Because as you know, when you unload your dishwasher at home, you look at everything before you put it in the cupboard. Because, sometimes something dried on, stayed there, or whatever. But if you get a lumen at your desk and you go to put a brush through it or section it or whatever you're going to do with it, and there's gunk in there, education. So yes, that does need to be documented as a quality event within education. Use those staff members there again, that your great staff members, the ones you want to retain, you want to keep, maybe partner that person with them so they learn, so they know kind of like, hey, here's what I do, with your tracking systems too. put a note in there. So when I scan this container to decontam, I get a pop-up saying all these laparoscopic graspers come apart. The handle, the shaft, the tips, insulation, the everything. That way staff are going to learn, and that's how they're going to know. Along with that, then, with your quality staff that you want to retain, make sure you're not giving them too much responsibility. Make sure you're not putting too much on them. So if you know that they're great at assembling this tray, that's wonderful, but don't make them always be the one that trains the new staff. It's really working
That's
together.
A great point. Mm-hmm.
Yes, and having that partnership. You know, I think back in the day when I was a scrub tech and doing instruments, when it came to assembling that shoulder scope tray, I didn't scrub ortho, and I did not know my ortho instruments, and I did not like the shoulder scope tray because I didn't know the instruments. It would take me forever to grab that paper count sheet and go through the list. And so I had a coworker who loved it, knew that tray like the back of her hand. And so when we were busy, I would joke and say, "Hey, Deb, shoulder tray's there." And she's like, "Don't touch it." Because she knew we don't have time for me to putz around with it. But when we were caught up, then I would take that time so I can learn it.
Mm-hmm. Yeah. I think you did a really, really great job. And I see a couple more questions that came through that we can certainly get to. We have about 4 minutes left, but I think you've done a really, really great job on showing how technology, and more specifically, how tracking systems can be such a critical tool when there is a staffing crisis. Really, building the opportunity for consistency and for standardization in every department.
Yes.
Yep.
Yeah, so let's see. We have one here about where a tracking system can be so beneficial, can identify if our quality drops with utilization of travelers. So let's look at this from both sides. Did your quality improve or did it drop? More importantly, you want to identify those trends and patterns. So it's, utilizing your quality feedback module, then running reports on a routine basis and identifying where there's trends and patterns. Because if you're seeing that it's one person that's having errors, they need education. If you're seeing that it's a certain set, so this set has had issues, 5 times in the last 6 months, well, when we need education on that whole set, not a person, but that set. And then what is that quality issue? And then how can we use that to educate and teach everyone? When you work in an area where the cost of living is lower than a major city, how do you get management to look at what you're worth? So that's a little more complicated. I do think of like government, where your techs, they're a certain grade, and it's across the board. However, then they have that cost of living factor, like a demographic factor that figures in. And so that's kind of where you have to look and say, okay, do you need some kind of a system like that? Or at the same time, maybe it's a matter of working with leadership and comparing your wages to, if your average wage in your town is $15 an hour, well, do a search and see what else in your town pays $15 an hour. And then use that as a comparison to say, okay, here's what else is paying $15 an hour. And that's what we are. And look at the responsibility that's put on us. We're saving people's lives. We're letting the OR operate. We're letting your clinics function. And none of this can happen. We won't be doing colonoscopies and upper endoscopies if it wasn't for my department. And look at the money that's generated from there, as well as look at the money we're not having to pay because we're preventing infections and complications.
Yep, great point. And I think, there's also, when you have a full competent staff and you're not spending time onboarding and training and everybody is on the same page, you're saving money because the efficiencies are there. It's and then you have the efficient tracking systems. Everybody's trained. You can definitely follow up with the processes and make sure that everybody's doing their job. But it's a tough time right now. So there's not an easy answer. But Kelly, you've really touched on some great topics and also had some good insight and some some suggestions on how to improve some of those challenges and to address some of the C-suite leaders. And we do appreciate you joining us. Sorry again for the technical issues. It tends to happen these days. But
right, and we have filmed many of these together and have never had this issue. So don't know what's going on today.
Yeah, well, it happens, and at least you're on, and we do appreciate you as always. And if anybody out there has any questions or anything comes up after this discussion, please feel free to reach out to Kelly directly. Her contact information is right there on the front page. And also, you know, as things come up, as time goes on, and maybe you circle back to this presentation and you have more questions, please feel free to reach out to Kelly. She's always available to help and answer questions. So thanks again,
yes,
Kelly.
Thank you. And yeah, and even if you're not a CensiTrack customer, feel free to reach out to me because I'm always there to, wanting to help people.
Great.
Awesome.
Well, thank you. And just as a reminder, we've got a quick 15-minute break and then on to the next session. Thanks again, everybody, for joining us. We'll see you soon.
Thank you.